I'm almost 50, strong, clear, energized. Training hard, living clean, fully alive. But it didn't start here. 30 years ago, I was diagnosed with multiple sclerosis, and I felt hopeless. But I chose a different path. No meds, just science, discipline, and results. Now I'm symptom-free and asking the tough questions that move us all forward. This is Hope and Health. Let's go. Hello and welcome to Hope and Health. Today we're talking to Dr. Tim Warwick, who's a longevity specialist, a naturopathic doctor, and founder of the Longevity Lab. Dr. Warwick, thanks for joining us today.
Thanks for having me.
So let's jump right into it. What is the Longevity Lab?
So we're about 3 years old now. We're a multidisciplinary clinic with a focus on longevity medicine. So keeping people healthy as long as possible, reducing disease burden. We see all kinds of different patients, patients who are healthy and want to remain that way, and others with a chronic illness, sometimes quite debilitating illnesses that we're trying to kind of improve their health and help them work towards remission or whatever that looks like for them. And so I've got a team of over 20 people at the clinic, and so that keeps me pretty busy.
That sounds perfect, because on Hope and Health, we talk a lot about multiple sclerosis, but we also talk about other chronic illnesses. So we're going to have lots of questions for you, and hopefully you can give our audience some advice or at least some thoughts.
Absolutely.
Now, as a naturopathic doctor, can you give us a little bit of your background? Like, what's your education and what do you specialize in?
Sure. Yeah. So I did an undergraduate degree, Bachelor of Science. I double majored in biological and physical science. So it was a lot of biochemistry, a lot of chemistry, genetics. I had an aptitude, I think, for science and math. So that was interesting to me. So I kept pursuing it that way.
Right.
I didn't really know what I wanted to do. And from an early age, we were kind of, reinforced to eat healthy. We had like a family garden, all of the different, the pillars of health, really. So physical activity, having good, relationships with family and friends, and trying to kind of foster that sense of purpose, I think, was really important. And so I was still kind of chasing what my purpose was through university. And I stumbled upon naturopathic medicine, and I was like, well, that's really interesting, because it combines a lot of the things that I felt were missing when I spoke with my family doctor and, read about, I guess what people were getting done for their health or to manage their illness. And so it sounded really interesting. So I kept going 4 more years, 4 more years of debt, and graduated in 2013. And so I've been practicing in Calgary ever since. So yeah, does that help? Does that answer your question?
It totally does. Now, what do you think are the big misconceptions about naturopath medicine? Yeah,
so not every province or state is currently like a regulated jurisdiction. And so with that, you have, we call them undies. So they haven't done like their formal, accredited program with, practical hours and exams. And so they're not really like a regulated health professional. Whereas in Alberta, it is a regulated profession. We're under the Health Professions Act, just like medical doctors, surgeons, nurses, dentists. And so you have to kind of maintain your license. And so I think we're held to a higher standard. It's a lot more evidence-based, and, we have to basically show our work a lot more. Yeah, I guess one of the misconceptions is that it's kind of like a weekend course that we go to.
Right.
But you need to have an undergraduate, at least 3 years undergraduate. At one point, you needed a degree. And then it's an additional 4 years beyond that to get your ND, naturopathic doctor title.
Got it. Now, our audience, we have people with multiple sclerosis all over the world. Mm-hmm. So people get neurological symptoms. Mm-hmm. Sometimes they go to their GP. Sometimes they go to their emergency room. They're not necessarily referred to a naturopath right away. They're off to a neurologist.
Yes.
And now, why do you think that is?
I think that's starting to change, but generally, the Canadian healthcare system is getting more and more siloed, I think. So the neurologist deals with these concerns, the psychiatrist deals with these concerns. And so I find there's less communication that happens as a result. There's so much to know, right? There's so much information. And so you get specialization, but you also get siloing of medical professionals. And so I think that like I said, it's starting to change where you're going to see more acceptance that things like diet and lifestyle and nutrition and potentially things like vitamin D supplementation and optimization have a greater bearing over the disease pathway, right? Or the pathway to health. There's some limitations, I think, in terms of what medical doctors are allowed to do and who they're allowed to refer to right now as part of kind of their guidance documents. So that's part of it. They're not really allowed to refer formally to a naturopathic doctor right now. They might be able to hint the patient, you should work with somebody who knows about vitamin D or knows about, nutritional strategies for MS or autoimmunity, right?
Right.
But they're not necessarily getting that in the family doctor's office or the neurologist's office or the hospital.
So if I've been diagnosed with multiple sclerosis, I go to the longevity lab, what happens?
Yeah, so we do a detailed hour-long initial visit. So assuming you're meeting with somebody like me, a naturopathic doctor, I have 4 others that work with me. And so we really dive into health and we go through, chronologic health history. So going back to childhood illnesses potentially, and, what was your health like as a child, as an adolescent, go through any significant, traumas, accidents, injuries, concussions, medications, when were they started, when were they stopped. So it's fairly detailed. A lot of people are surprised at how kind of deep we go. But for me, I kind of think of myself like a health detective. So I'm asking these questions intentionally to figure out what systems or pathways could potentially be off and contributing to the autoimmunity, the underlying disease pathway, right? So the imbalances, right? Dis-ease.
Right. So you see things like a concussion or a viral infection. These are things that are triggers. I mean, they're all possible causal factors.
Yeah. Yeah. Did you get mono when you were a teenager, for example, right? And we also look at lab work. And so, inflammatory markers, nutritional markers, we have the ability to test all that stuff as well. Potentially autoimmune markers, right, which can give us guidance. Is your immune system behaving properly or is it not behaving properly? And so being a good detective and figuring out, okay, what's the most likely reasons why your immune system's not behaving properly?
All right. So now I've had all these tests. What is normally the course of action for someone with multiple sclerosis at a clinic like yours?
Yeah. And so one of the issues is there's so many things that we can do, right? And so many things that are important. So we try to prioritize that for the individual, right? So for some people, maybe it's their diet that's like the biggest, barrier. And so we're going to work there first, right? And so maybe they've already been eating really clean for a decade. They know lots about nutrition. So maybe that's a lower priority. We still look at a lot of I call them the pillars of health. So that's like, getting out in nature, exercise, fresh air, vitamin D, your community, right? So the relationships you're having, your sense of purpose, nutrition. So spend a lot of time there on nutrition. That includes dietary supplementation or natural health products, we call them in Canada. But also elimination, right? So it brings in kind of gut health. What's this person's digestive system doing? Is there evidence that there are chronic infections in the gut that we need to address, i.e. dysbiosis? And then sleep and stress management, sharpening the saw. A lot of folks with autoimmunity, they also have disturbed sleep. And then finally, just looking at for me, I think creativity is really important and as a pillar of health. And so whether that's writing, music, something else that's, maybe not so academic. And, but I think a lot of people have lost that. And I think it's important to have that, whether it's like storytelling or having good conversations, problem solving, that kind of thing. So.
Now, I talk a lot about diet in the work that I do. What are the dietary recommendations that you normally make or you normally see?
So there's no perfect diet for everybody, first off, right? And so I would say as a starting point for most people, I would look at something resembling a Mediterranean diet where we're looking at whole foods, not too much sugar, not too much processed food, lots of, brightly colored fruits and vegetables, healthy fats, right? And then good quality protein. For some, we may modify that to maybe more of a low carbohydrate, Mediterranean, almost resembling kind of, at least in the same spectrum as like a ketogenic diet potentially. But it really depends on what we see in the history and the lab results. So their metabolic health, right? Maybe we have to be a little bit careful with high fats if they're already not very metabolically flexible.
So let's back this up. What is metabolic health for people who don't know?
Yeah, so metabolic syndrome is basically you having problems with cholesterol, body weight, blood pressure, blood sugar, essentially, right? So the body is losing its ability to burn fat for energy, right? It's more inclined to burn carbs. And so when you put people on a ketogenic diet, for example, or get them to fast and they feel like crap, it's because they're not actually able to harness that as a fuel source. And so they get the keto flu, or they're getting those fasting side effects, for example. So we want to improve metabolic flexibility, and that tends to track with longevity.
So if someone's out of balance, what are the kind of things that you do to restore it?
So I'm a big fan of fasting, intermittent fasting. I think that can be one tool that's really helpful. Obviously, diet has to be there, right? So Canadians are eating a lot of processed foods, lots of added sugars. So that can be very problematic. Moving more towards whole foods diet, like I said, is really important. Exercise, right? Moving your body, breaking a good sweat a few times a week is really important as well. Certain nutrients are really important for our metabolism as well. B vitamins in particular, right? That's kind of like the lubrication of the machinery of our metabolism, right? And a lot of people, especially if you're eating poor quality foods, you're going to be deficient in a lot of those things too. So
if I come in with multiple sclerosis, we're changing our diet, we're changing the way we exercise, and you're adding supplements.
Yeah.
Now, how important is that supplement piece for people?
Vitamin D is critical. If you live in Canada, you need to take vitamin D, period. The dosage that we often shoot for with autoimmunity is higher. There's a blood level that we're kind of hoping to achieve. For the general population, 50 to 200 nanomole per liter is kind of the reference range. I would say for autoimmunity, you want to be 125 to 200, so kind of in the upper half or so of that range, because that's where you turn on a lot of the genes related to our immune system.
Got it.
You will not hit that with doses less than 1,000 units a day, and that's been scientifically validated. So personally, I take about 6,000 units in the winter. I'm not telling people to do that, but I test my levels and I know that's what my body needs to get there. It might be different from person to person.
Now, how does someone get their vitamin D levels checked? I don't think that it's covered in Canada anymore, is it?
It's covered if you have 3 different diseases. So if you don't have those, then it won't be covered. You have to pay out of pocket. So for most people, they'll end up having to pay out of pocket.
So what are the diseases you have to get your blood checked for vitamin D?
I believe osteoporosis.
Yeah.
Other kind of calcium metabolic issues. And then I think, parathyroid disease is another one. Yeah.
So in today's world, it's not easy to get your vitamin D levels checked.
It's easy if you pay. Yeah. And come see, somebody like me. It's pretty easy to do. Yeah. $60 or so, somewhere in there.
Okay. So what other kind of practices are you doing besides that?
Yeah. So, I mentioned B vitamins. Those are really critical, right? The myelination pathway, right, is very B vitamin dependent, right? And so B12 gets a lot of kind of praise, but, they all work together, really. And so B12 is really dependent on B6 and B9 folate, right? And so those are things that we can also test. But most of my patients were at least thinking about methylation generally, right? Methylation, that's an important pathway with your B vitamins, especially for things like myelin and detoxification and neurotransmitter production. So that comes up a lot in the multiple sclerosis realm as well. Some people are genetically susceptible to having methylation problems. About 1 in 3 people probably have a fairly significant issue. And those are also things that we can look at with genetic testing potentially to kind of tease those apart. There's blood markers that we can measure to see, how efficiently your methylation pathway is doing. So if it's not looking very good or it's out of whack, then that might allow us to take a bit of a deeper dive and see what specifically is going on there. So there can be a lot of nuance within all of these different nutrients. There's no like cookie cutter, this is my MS protocol that I use for everybody. It's different for everybody. There's maybe some overlap with specific things that we look at that are just really important, but how it's presenting, what are the main kind of symptoms that they're managing, and what their history is like is going to dictate the other priorities that we want to focus on.
I want to go back to one thing, and that's
Sure.
the difference between food allergies and food sensitivities.
Yeah.
And how someone who wants to investigate that gets that tested.
Yeah, so food allergy is usually more of a rapid onset, right? So you have some peanuts, you got a peanut allergy within 15 minutes. Usually, you're starting to itch or swell, or right, and so it's more obvious. Whereas food reactions, other food reactions, food sensitivities, might be more subtle. They might not happen right away. It might take hours or even like a day later where you start to notice more problems. And it might be something that builds with more exposure, right? So you can tolerate a little bit, but if you eat more and more and more of it, then it starts to increase over days potentially. So they're harder to identify generally than an allergy, right? With an allergy for testing, you also kind of have a critical window where you're going to see that IgE antibody in the blood.
Right.
And then it's going to disappear, right? So unless somebody just had an allergy, right, an allergic reaction, it could be a false negative, right? So if you have, like, say, a shellfish allergy, but you haven't had shellfish in 2 years, when you get tested for a shellfish allergy, your IgEs are going to be 0 because you haven't been exposed, right? So what we do, usually to prepare if we're doing food sensitivity testing, is get the patient to eat a fairly diverse diet. So try to eat the things that they normally would so that there's less of a risk of false negatives on the testing. Obviously, if there's any strong reactions or allergies, we want to avoid those, right? Mm-hmm. But for subtle food reactions, sometimes you can unmask them with this kind of testing.
Now, something else you guys do is you do IV therapy.
That's right.
I've heard about this. Can you explain to us, our audience, what that is and what that entails?
Sure, yeah. So IV is intravenous. So we basically are delivering nutrients and other agents directly into the blood. The benefit of that is you're bypassing the gut. So you're getting basically 100% absorption. Certain nutrients don't absorb that well. And so that can be a limitation. You take lots and lots of it by mouth, but it doesn't absorb. You may have, GI side effects like vitamin C, for example. You take more than like 5,000 milligrams of vitamin C, you're probably going to get diarrhea, right? Whereas if you do that intravenously, you don't get any bowel effect at all. And we can even do, 50,000 milligrams or 100,000 milligrams of vitamin C in an IV, and there's still no GI or digestive upset.
Goes right into the body.
Right into the blood. Yeah.
Wow.
And so you can overcome that as a potential absorption barrier, right? Other nutrients that we would use in terms of with more application to multiple sclerosis would be things like curcumin. So that's the anti-inflammatory compound found in turmeric. Mm-hmm. And so lots of studies on its use in vitro, right? So cell culture, for example, looks fantastic, but getting it to the cell is the problem because it doesn't absorb that well. And so you can overcome that barrier by intravenous delivery.
Wow.
Other nutrients, so I don't know if you're familiar with NAD, nicotinamide adenine dinucleotide.
No, I don't know that one.
That's a big one, big trendy thing in longevity research right now. So it has a lot of cell repair application, DNA repair and cell repair. As we age, we produce less NAD. And so that's one of the, theories of aging is certain molecules decline and that kind of shuts off our repair. And that's why we age. And so NAD is one of those molecules. Glutathione would be another one. That's kind of the...
Okay, so how do I get those molecules? Are those the only... I can only get them by IV?
No, you can take precursors to NAD, for example. Okay. But you may not get, 100% absorption. You may not get the same effect with the same dose given intravenously, for example. Yeah. NAD is a pretty complex molecule. So if you take it orally, it just gets chopped up into different pieces. So basically you're getting expensive niacin, vitamin B3. And so it's not going to have the same effect.
Got it. Now, what about chelation?
Yeah. So chelation therapy, sometimes heavy metal reduction, we call it, right? Because we're binding toxic or heavy metals in the body. It's something that I do. I'm very interested in, coming from a dental family and like kind of mercury in dentistry and concerns about that. There's some hypotheses that heavy metals, mercury, lead, cadmium, arsenic can be part of what's causing autoimmunity as well through something called hapten formation. So a metal binds to a protein, right, in your body and changes the shape or the structure or how your immune system perceives that particular protein, right, and then mounts a response, right? So it's basically potentially confusing your immune system and creating more autoimmune reactions or inflammatory reactions. So the tricky thing with metals, heavy metals, is we all have them, right? They're naturally occurring, and we're all exposed at some level, right? And so how do we know if this person has more, right? Or how do we know that they're causing a physiologic effect versus kind of like, the normal amount of toxic, right?
Right.
Because there's no safe level of exposure, right? So the more they accumulate, the more potential they have to cause harm. So, and testing is not super straightforward. Blood testing only really gives you a recent snapshot of exposure, not really, what you might be exposed to over decades.
Right.
So it might be good for picking up acute exposure. So if you're like a welder and you're breathing in all kinds of lead, right, we might see that. But if you were a welder 40 years ago, right, and you still have a ton of lead in your body, it's just not in the blood anymore.
Right.
Right. Does that mean it's not having an effect on your brain? Right. And so back to chelation, that is what we're going to do. We're going to use a chelator such as EDTA to bind lead and pull it out of their body to reduce their body burden.
Dr. Warwick, we were just talking about chelation therapy and trying to get heavy metals out of the body. Can you explain to us, our audience, what that is and what that entails?
That's a good question. So for metals like lead and mercury and cadmium and arsenic, they have a really long half-life in the body. So what does that mean? It means once they're in your body, really, really difficult to get them out. So for example, cadmium in certain tissues in your body, half-life is 50 years, 50. So effectively, if we don't do chelation, you're never going to remove it from your body in this lifetime anyway, right? So I would argue that chelation really is the only way to remove certain metals like cadmium, which is a known carcinogen and has a lot of other negative health effects as well. So for example, if we're talking lead or cadmium, EDTA is kind of the preferred treatment there. Intravenous is the preferred route of delivery. And it might depend on the person, what the dosage is, and if we want to add things like glutathione or methylated B vitamins, vitamin C to help support the chelation or detoxification process, which is what we often do. So it might depend on the person as well, what we kind of want to do. There's everything pretty well is individualized and customizable. And yeah.
So I can only guess that you've seen hundreds, if not thousands, of MS patients in your career.
Yeah.
When these patients come in, is there a consistency to how many problems they have? Are you normally seeing issues with diet, exercise, mindset, heavy metals, and all the other things like lack of nutrients, vitamins? Is it consistent?
There are certain things that, we see a lot of kind of overlap consistency between patients. I would say one thing we haven't touched on is gut microbiome. That's I think that's just for everybody these days. There's so many modern challenges to our microbiome, and we're seeing even people who eat really healthy, still finding imbalances in their microbiome. So microbiome is these hundreds of different types of bacteria in our gut, trillions of individual bacteria, right, and other microorganisms, mostly bacteria. The health and the balance of that can dictate a lot about our immune system as well, and the gut barrier health, and so that's implicated in autoimmunity as well, and of course MS as well. So for new patients, the reason why we want them to eat healthy is not just for nutrients, but to reestablish their healthy gut flora and maintain integral gut barrier as well. So we're not having as much immune activation along that gut barrier.
So let's talk about that quick before we get in there. I think it's called a leaky gut from what I've heard.
Yeah, or in the medical journals, it'd be intestinal hyperpermeability, but same idea.
So what exactly is a leaky gut and why is it causing problems?
Yeah, so most of the surface area in your gut. So your gut is your gastrointestinal tract. So basically from this end to that end, most of the surface area is going to be in the small intestine, right? We have these villi, right? The little kind of finger-like projections, right? Increase surface area to increase absorption. And so if we were to kind of unfold all that, it'd be about the size of a badminton court, thereabouts, right? Wow. So quite a bit of area stuffed in there, right? And so if you've got, if you're taking, certain medications that damage your gut, if you're drinking too much alcohol, if you're exposed to chemicals or toxins that can damage the lining, if you've got dysbiosis or an imbalance of your gut bacteria, all of those things can basically damage the lining of the gut. So then what we have is activation of the immune system because there's things that are coming through that aren't really supposed to be coming through, right?
Okay.
And so we call that translocation. And so you can have translocation of bacteria even, right? So you have bacteria leaking from your gut into your bloodstream, right? Not so good. You can get pieces of bacteria, right? So the cell wall of bacteria leaking across. You can get pieces of food particles that are still immunogenic, meaning your immune system recognizes them as foreign and mounts a response to them. So all this can really confuse the immune system and cause a lot of immune dysfunction, inflammation in the body. The next stop from your gut, all of this stuff has to go through the liver. And so then the liver can get upset and you can get, fatty liver or different challenges with, bile flow, which can compound the issue in the gut as well. So it's, the leaky gut is a really, important thing to deal with if that's happening. Folks who've got like lots of allergies, eczema, asthma, those kind of histamine mediated, issues, often you can trace that back to gut health. And if you can fix the gut, then a lot of those histamine and immune reactions will kind of go down with time.
Okay, so if I have a leaky gut, how do I fix this?
Yeah, so part of it is fixing the bugs, the bacteria, right? So going in, if there's things like yeast or candida overgrowth, there's strep overgrowth, there's a whole slew of other bacteria that we often find in autoimmune patients and people with various digestive concerns. And so we want to basically make your gut not a very nice place for them to thrive, but we want to make it a nice place for the beneficial bacteria to thrive.
The good bacteria.
That's right. You got it. Yeah. And so there's there's different ways of classifying bacteria, but there's, about 6 different kind of broader families of beneficial bacteria. And we want that diversity in all of them. And so that is part of the challenge, is to know, what your microbiome looks like, what it might be missing compared with mine.
Right.
And then we just want to kind of nudge it towards balance.
Now, I've heard there's even tests now people can get what specific bacteria they need.
Yep, exactly. Yeah, we do that all the time. So it's a stool sample. It's a lot of fun, right?
Yeah.
But most patients will say, 3 months down the road, when we have a lot of headway made, they're happy to do the stool test because they feel so much better. So, but anyway, we send the stool sample away to a specialty lab. They look at all of the different microbiology, so bacteria, yeast, potentially parasites. We can also test for inflammatory markers. We can test for indicators for leaky gut, intestinal permeability. We can look at short chain fatty acids. So if they're eating, a healthy diet, we should see lots of short chain fatty acids in there to preserve the integrity of the gut as well. And if they've got good bacteria, that's the caveat there too. So there's lots that we can look at.
So if I go into your clinic, I've got multiple sclerosis, I got a lot of work to do is what you're saying.
There's a lot of things that we need to check off the list, I would say, to make sure it's optimal. And if it's not, then we ought to get you there.
So I'm changing my diet, I'm changing the way I exercise, I'm changing my supplements, I'm possibly having IV therapy, possibly trying to get rid of heavy metals.
That's right.
If I do all these things, what have you seen with your own eyes in regards to people who are struggling with MS?
Yeah, so the trouble is I'm usually not the first doctor these people are seeing, right? I'm like the 4th doctor they're seeing, right? They have, they've seen an emergency doc, they've seen their family doc, they've seen a neurologist, maybe they've seen a rheumatologist or internal medicine specialist as well. And then they're like, well, I'm on these medications. I'm feeling a little better. I don't feel optimal, certainly. And, maybe I'm still having relapses every, 3 months, 4 months. There's got to be something else, right? And so then they start exploring the realm of, natural medicine and diet and all the things that we've talked about. And they think, well, maybe I should go see somebody who knows a lot about that.
Right.
And so then that's when I see them. So they've already done a lot of their own research and a lot of their reading and things, but, and they're probably already on, a decent start for their path. But my job is to really identify what's going to make the biggest bang for buck for them, because that can be different for different people. So,
right.
And so, if they put in the work, I would say a lot of people see results in like 3 months.
So within 90 to 100 days, you're starting to see results.
Absolutely, yeah. I'm not saying that we cure people in like 90 days, but certainly I've had patients where they're having very frequent relapses and kind of bounce from this med to this med. Nothing's really kind of working. And then we address these things, and then it's years since their last relapse, and they're stable, either on or off medication. They're feeling great.
No, now what's the most dramatic recovery you've seen?
I mean, I've had patients who were nearly wheelchair bound, right, and they're walking again. So it's amazing.
What's it like for you when you see that?
I mean, I'm proud of like natural medicine. I think that that's, and because I don't think it gets enough credit. And I'm also proud of the patient, obviously, for working so hard to accomplish that. I wish there were more, data points that we could collect to show people that this works. I wish there's more funding so that we could run, trials and studies to look at this more closely. So to give people hope that, they're not just going to be stuck on these really, expensive drugs for their whole life, which have, a lot of side effects as well. So, and I don't promise patients that, I'm going to get you off all of your medications, that's a possibility. But, I think people generally, they get what they put in. So if they work really hard to improve their health, they're going to get results. And if it doesn't pay off as much in the MS arena that they might have thought, definitely they're going to be their joints are going to be feeling better. Their metabolic health is going to be better. Their mental health is going to be better. So those are the collateral benefits that we capture as well.
Tim, you said you get what you put in. How important is it for the patient to take personal accountability for their own health?
It's critical. The patients who put in the time and the effort, they get results. Patients that, come to us and they're kind of like just a bit passive, like, fix me. They're probably not going to get better, right? There's no magic pill that's going to make everything go away, right? It takes work and determination and perseverance. And, healing is not just a linear line, right? There's bumps in the road, right? There's plateaus. That can be frustrating. And so, being mentally strong as well, I think is really important for healing. And so that requires a lot of support.
Did you see it as a mindset? Can you tell almost right away if someone's got that ability?
5 minutes.
Yeah.
Yeah.
If they're really going to dig in and get after it.
Yeah.
Now there's, one of the things we talk a lot about is the Epstein-Barr virus when it comes to multiple sclerosis. Also, recent research shows it's 100% of lupus patients, I believe in a recent Stanford study that I was looking at, as well as linked to Crohn's. So can you talk a bit about a viral infection that most of us get in our youth that can manifest into something far more complex down the road?
Yes. So EBV is kind of the famous one, Epstein-Barr virus. There's a number of other herpes family viruses as well. And so if you think of like shingles, right? The chickenpox virus that can come back that way as well. These viruses, they have a tendency to go into hiding, right? So there's kind of a question of whether we even really clear viruses, right? Because it's a kind of a non-living particle. And it hijacks our cell, mechanics to reproduce. So, do we really can we kill them? Right? It's not a living cell. It's a particle. And so, I think the hypothesis is that for some people, if the virus goes into hiding, is able to come out of hiding, it causes more immune disruption or dysfunction and potentially autoimmunity. So Epstein-Barr is not the only one that can do that. I think it's just the most famous one. I would argue other chronic infections can also be kind of part of the issue as well. So coming from a dental family, again, we talked about, root canals, for example, and dental infections. So we talk about root canals for a sec?
Sure, go for it. Okay. I think our audience knows that, and I know it's never just one thing.
Yeah. So root canal or endodontic restoration, we're drilling out and removing the blood supply to the tooth, right? We're removing the nerve. The problem with that is your immune system is in the blood, right? And so that tooth is now dead and it has no immune system in it. And so what can happen, and it doesn't always happen right away, it could take years or decades, but a lot of the time this does happen, is your body will start kind of walling off that tooth because there are foreign pathogens invading it.
Right.
And over time you get what's called a, inflammatory granuloma around that root of that tooth. So your body's trying to protect you from the invaders coming in through that tooth. So that can create, obviously, a reaction of the immune system. There's other kinds of dental infections as well. It's just the problem with root canals is we don't have a nerve. So pain is not necessarily a presenting symptom. It can be a painless chronic infection, right? So, there's, a lot of my patients who have inflammatory or autoimmune conditions, we're asking those questions about their dental health. Do you have any root canals? When were they placed? How old are they? What do they look like? And then sometimes there's specialty imaging that we're doing to really examine if that tooth is still in good shape or not. And so, so your mouth is part of your gut. And so you want a healthy mouth, you want a healthy gut. So people with like periodontal disease, gum disease, lots of gingivitis,
right?
Not taking good care of their teeth, right? That can be another breeding ground for these chronic infections. So
now, just listening to this conversation we're having, this is a far more complex process than going to a neurologist where I just see an MRI and then I'm given a drug. The things that you're describing, I can't see. I can't see if I have a root canal that's gone bad. I can't see if I've got a nutrient deficiency. I can't see if I have food sensitivities. So it seems like it's a great deal of testing. It's individual, and then it's adjusting my program. Is that what, does that make sense?
Exactly, yeah. And all the while trying to like meet the patient where they're at. Because I have some patients and they're super interested, they're eager, they're willing, right? But it's like, you got to do baby steps, right? So you got to learn to crawl before you can learn to walk, right? And so, for me to say, you're going to need to do $8,000 worth of testing, probably not going to be well received by most, right? So we start with, okay, what's going to make the biggest difference in the next 90 days, for example, right? Because if I can show them that they can feel better in 90 days, then that allows more trust as well. They're like, this guy knows what he's talking about, right? My digestion's way better, right? I get more energy. My nutrient levels are better. My blood work looks better. I think we're on the right track. So then we can look at things like heavy metals and some of the more like specialty testing, perhaps that, going for a CBCT scan to look at your root canals, for example. So that might not all need to happen first visit, right? We have kind of like a priority list that, this is the biggest payoff. So let's really dive into that first.
Now, obviously, Dr. Warwick, you have a huge knowledge base on a variety of things. You've seen multiple patients. You've got multiple strategies to deal with things. With what you know now, is there any disease that scares you?
Definitely. Yeah, for sure. Fear is a really good motivator for sure.
Or do you feel like, what I'm trying to get at is, do you feel like there's always a way out?
I think there's so much that we can do. As far as like what motivates me, I make a living off my brain essentially. So I want to make sure I can be as sharp as possible for as long as possible. And so, cognitive decline, Alzheimer's, that to me is really scary, I guess. And you see family members who, basically suffering, kind of locked in, and it's awful, right? And so I guess that would be one. Cancer, my grandfather passed away from pancreatic cancer. That's an awful, awful illness. Fortunately, it was quick for him, but it was, that quick amount of time was a lot of suffering as well. So, I look at in some of my patients who have cancer or like a terminal illness, I look at my job as to try to preserve dignity as best I can, but also to reduce needless suffering as much as possible. So, with that, that helps alleviate some of the fear, I guess, because I think there's always something we can do for this person, and even faced with like a horrendous diagnosis. So.
And for people with multiple sclerosis, where do you encourage them to find the hope?
Yeah, it depends on what inspires them, right? So there's some good books, I think, that are written on the topic. Support at home, I think, is really important too. It's tough when the family is maybe not all on board with, the diet or the direction of treatment that they're trying to go with, right? So, I guess having conversations with especially people who are closest to you, and that's a good place to start. I think, working with people who have experience with using these strategies, these medicines in this particular, type of patient. Yeah, community groups, right? I think that can be a great place to learn new things as well. And, it might be super scary for the first few months, and then you meet somebody who's, they've had it for a few years or a few decades even, and that can alleviate some of the fear and increase hope.
Now, 30 years ago, when I was diagnosed, I quickly found a doctor very similar to you, and I embraced that path wholeheartedly at 19 years old and never really looked back. Back then, it was fairly divided. It was natural medicine and then conventional medicine. Do you feel like those worlds are starting to come together more and more?
I think it's slow going, but yes, we are seeing some, I think, more acceptance that there is, in fact, evidence for natural medicine and a place for diet with pretty well all chronic illness, right? Including MS, of course. And even though it may not be the kind of priority to the medical doctor or the neurologist, they know it in their mind that if they have a patient who's unhealthy in every way, they're not going to have as good outcomes as somebody who is exercising and is managing their stress well, sleeping well, eating well, right? And if you look, right, go to your PubMed, right, your medical journal, in your search tool, whatever you use, it's all there, right? The information is there. I think the AI, ChatGPT, et cetera, those are making it even quicker to access, right? And help summarizing if you use those tools properly. And so I would say there's lots of evidence there, and it's just a matter of acceptance and kind of, I guess, like the medical dogma takes time to dissolve, right? So, but we're seeing it a little bit.
Well, Dr. Warwick, you're doing important work. Thank you so much for joining us today.
Thanks a lot for having me.
Thanks for joining us. Hope and Health is made possible through generous donations. To learn more or support the show, visit mshope.com, where you'll find free science-based resources.